With men, the distribution is well localized and usually in problem areas that makes it for a very gratifying procedure. Hello and welcome to this edition of the Wise Medical Minute. Today we're going to talk about liposuction, obviously one of my favorite subjects, but we're going to specifically address this procedure when it comes to men. Now, in the past, men have been as much as 20% of our patients. And in the recent couple of years, that number has dwindled down to less than 5%. In the last 3 or 4 months, that number seems to be creeping up again. So I figured it'd be a timely topic on that basis. Now, we do liposuction in men using the same technologies as with women, basically, under tumescent anesthesia, with IV or oral or both sedation. We don't use general anesthesia, not even for the wimpy guys. And men do tend to be more wimpy than the women, by far. But the unique things about liposuction in men have to do with the distribution of their body fat, obviously, and the objectives they want to accomplish in terms of their body image. Men don't, I shouldn't say this, I just realized what I'm saying here, but men don't generally want curves, the heterosexual males, but then the concept with the body contouring, therefore, has to be approached differently as far as just the anatomy of a male. Now, men tend to have more of a pot belly, and what I was really leading up to addressing is the fact that males tend to have a higher percentage of visceral fat deep to the muscle that is not amenable to liposuction. We can't get cannulas down that low without hurting somebody. So superficial fat is a lot more plentiful in the female with normal female anatomy. And the percent body fat is much higher in the normal and even the overweight female. So with men, the distribution is well localized and usually in problem areas that makes it for a very gratifying procedure. Now we'll show some before and after examples here, and you can get an idea of how gratifying this procedure is. Now, the unique thing, in addition to having problems with more visceral fat, is when guys come in, they tend to come in with abdominal procedures or gynecomastia, or so-called, I guess I can say bitch tits on YouTube, but guys who work out in the gym, who are on steroids, or guys who are just overweight in general and their livers converting their testosterone to estrogen, they'll have breasts like women and they don't like it. The bottom line though is I've observed that more than half, probably more than 80% of the guys who come in with the gynecomastia procedure, which is our second most common procedure for men, they smoke marijuana. So the hormonal consequences of marijuana predispose to the gynecomastia that is a common reason for liposuction in men. So don't waste your money if you're not going to stop smoking weed, is my message. Because it comes back, and they hate to redo procedures that you did a good job on before. But marijuana is a predisposing factor to the development of gynecomastia in men, and therefore I'd be remiss not to emphasize getting off of it when we talk about treating gynecomastia with liposuction. Now, the other issue that's a little more common in men than women is plain old tobacco smoking. Cigarette smoking compromises the skin retraction after a liposuction procedure. So it's important to emphasize smoking cessation, which tends to be a bigger problem in men. We don't deal with the autologous fat transfer very often in men. That's kind of rare even, but in that context, the fat just doesn't have the viability that it has in women. So I've reached a point I almost don't recommend it at all in men who are not on some kind of hormone altering therapy. Now, the unique thing that makes men the suitable candidate, or even the best candidates, are for the so-called ultrasound-based etching or vaser etching. If a guy has a six-pack, and I emphasize if a guy has a six-pack, and he just needs to have the fat removed, we can unveil the underlying six-pack very effectively with some high-definition liposculpture using ultrasound-based techniques. So men tend to respond better to that form of this art. Now, in a future video, in the very near future, we're going to talk about non-invasive ways to actually build muscle. Not just muscle for a six-pack, but the technology now allows us to actually exercise the arms, exercise the legs, exercise the abdominal muscles, and even the buttocks. And we can build muscle with some of the non-invasive technologies that if you don't have a six-pack, we can create one. That's getting to be something new that we'll talk about in an upcoming video. Also, in another video down the road, related to liposuction again, we're going to talk about skin tightening techniques, both invasive and non-invasive, so stay tuned. And with a little bit of luck, we'll do a summary type video where we talk about all the tangentially related technologies that enhance liposuction. A lot of places where they do liposuction in a factory-like fashion where they run lots of people through every day, they demean the benefits of the various technologies that enhance the results from this procedure. I like to play with my toys. I'm not going to deny it. And if you know how to use the technology, it does make a difference. So stay tuned, and in our future videos, we'll be talking more about the technologies, not just for men, but for women as well. Some of these things work so well in men that I thought it appropriate for this recording. Thank you for your attention. I appreciate the opportunity to share information with you. And if you have questions or concerns that you want me to address in future recordings, info@wisemedicalcenter.com. And I urge you to subscribe, and you can be kept aware of the different topics we talk about each week. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.